the body that helps digest food through the intestine. It also controls the internal insulin levels as well. It is a very important organ as it helps with the digestion of food. It is one of the leading causes of deaths in the United States. The exact cause of pancreatic cancer is still unknown, but there are some common factors of pancreatic cancer. Some examples include smoking or pancreatitis. People with diabetes can also be a higher risk of pancreatic cancer. This type of cancer is slightly more common in women than men. Statistics have shown that women are more susceptible of getting pancreatic cancer than men. There are many symptoms of the pancreatic cancer. They include but not limited to dark or cloudy urine, weakness or fatigue, loss of appetite or extreme weight loss, vomiting, or pain and discomfort in the lower abdomen, or back pain. There are a few different ways to test to see if you have pancreatic cancer. If your healthcare provider believes that you have pancreatic cancer, he or she will request the following tests: a biopsy of the tumor, a CAT scan, and or an MRI. All these tests can help the doctors figure out whether or not you have pancreatic cancer or if maybe you have something else. Chemotherapy is one of the most common therapies in treating pancreatic cancer. There are other forms of treating it, such as radiation therapy, targeted therapy, and clinical trials. Although these therapies can be very effective, they may not always cure the cancer. My grandpa died from this cancer. It was a very harsh cancer and shouldn't be taken lightly. I also work in the Rose Cancer Center, as many of you have known, as I have posted it before. Watching people that have pancreatic cancer or cancer in general is very hard, as you know. Watching somebody be sick that you don't even know is just as hard as watching one of your family members die from this disease. It is a very harsh disease and it is very, very painful. My grandpa was on all sorts of medications for it. They have painkillers, the chemotherapy, Coumadin, and different types of things to make sure that you stay pain-free while you are going through these type of treatments. The best way to avoid getting any kind of cancer is to stop smoking if you're a smoker, which every doctor tells you that. Eat a healthy diet and stay as active as you can and maintain a healthy weight. Which, again, every doctor is going to tell you that to be healthy and exercise and eat right, and you're going to stay healthy. There are many support groups out there that you can turn to if you need to talk to somebody. They're there to help you and let you know that there are others out there that are also going through the same thing as you are. Going through any type of cancer by yourself, nobody should have to go through any kind of cancer, any kind of illness by yourself. If you're ever feeling alone and your family members aren't there, there's going to be that support group. You can ask your healthcare provider, you can ask your friend, your neighbor. There's going to be somebody there that's going to help you through your situation. Pancreatic cancer, any cancers alike, are very painful and a very scary disease. So having somebody there to talk to, most of the time it's easier to talk to somebody who's not your family member, like a clinical trial nurse, rather than say your mom or your dad or your sister or somebody, because you're going to feel like that person has pity for you. Whereas if you go and talk to a clinical trial nurse, that patient or that nurse is not going to have pity for you. She's not going to want to cry because you're sick or whatever the case may be. She's going to be there to help you and guide you and say, well, there are other people that are out there that are doing it. I mean, she may recommend going on to a blog or maybe seeing a counselor or whatever. Just for people that do have cancer, just know that there are things out there that can help you. Also, if you need to talk to your doctor, I know I work at the cancer center, and we've had patients come in that just wanted to sit down and just talk to their doctor because they couldn't confide in their family member about their disease. They were too ashamed to talk to them about it. So having somebody from an outside perspective to talk to can always be a nice gesture. Again, I chose pancreatic cancer because my grandpa had died from this disease, and I just wanted to share with you what the cancer may entail. And I hope you guys found this very informative.